The average American spends about $100 a month on prescription medicines. Now, this is according to the healthcare company SingleCare.
But today, Amazon launched a new service hoping to get that price down to just $5.
$5.
So cheap. It would really help out a lot of folks. Amazon's RX Pass is an add-on option to Amazon Prime. If you already pay $14.99 per month for Prime, you can pay an additional $5 to cover all of your eligible prescriptions. According to Amazon's website, RX Pass subscription includes more than 50 generic medicines covering many common conditions. That includes everything from allergies to breast cancer and mental health. The program does not cover insulin, but some other medicines for diabetics are included. A generic form of Viagra is also covered by the program. The website goes on, subscribers can get all their prescribed medication on the RX Pass list filled as often as they need for one flat monthly fee. RX Pass also works with auto refill so that you'll get all of your eligible prescriptions automatically for no more than $5 a month. Here's the catch. Folks on Medicare or Medicaid are not eligible for many medications that are not covered by the RX Pass program. You can still get a discount with your Prime account through Amazon Pharmacy. And Amazon says you can cancel RX Pass anytime. This could really be a game changer for so many people. A Department of Health and Human Services report shows the price of more than 1,000 medications rose faster than inflation did in 2022. On average, prices went up 31%. That means if you were paying $50 for a medication in 2021, you'd pay now $68. Take a look at this. Drug companies usually raise prices the most in January and July. For the last 3 years, more and more price increases are happening. Last January, companies raised the cost of 3,200 medications. Now, pharmacists say they see just how much these price increases are hurting people. Oftentimes at checkout, customers are making decisions about which prescriptions they can skip and fill. And sometimes they say it comes to skipping medication altogether.
If you can't do without it, you have to figure out what you can do without, and you're talking food, rent.
Well, rising medication costs were really at the center of the new Inflation Reduction Law. Now, that law will cap the prices of some medications and allow the federal government to negotiate better prices for those with Medicare. The bipartisan effort will mean many seniors will start seeing savings worth thousands of dollars this year. Not only will it help with the cost of prescriptions, it makes important vaccines free for those on Medicare.
I would sometimes hear about people who are paying hundreds of dollars for a vaccine. Now, people who take recommended vaccines, which include things like shingles or shots for tetanus or whooping cough, will be free for people who are in those prescription drug plans.
Well, insulin prices, they were a big part of the discussion on Capitol Hill and capped at $35 when it was signed into law. Were they capped for everyone? Let's verify.
So let's verify. Was the price cap on insulin removed from the Inflation Reduction Act? Our sources are the Inflation Reduction Act of 2022 and the Centers for Medicare and Medicaid Services. This claim needs some context. The final version of the Inflation Reduction Act, passed by the Senate, does cap insulin prices for some people, but not for as many as originally intended. Let me explain. The original text of the bill capped insulin prices for both Medicare and private insurance patients at $35 a month. But the cap for patients with private insurance ran afoul of Senate rules, forcing a separate vote on that provision, which failed to get enough Republican support to pass. As a result, the approved bill caps insulin prices at $35 a month for Medicare patients only. More than 63 million Americans are enrolled in Medicare, and 1 out of every 3 Medicare patients has diabetes, according to the Centers for Medicare and Medicaid Services. So we can verify that the Inflation Reduction Act still contains a price cap on insulin, but it only applies to Medicare patients and not for people with private insurance.
Well, something to note here, Medicare plans have until the end of March to get that $35 cap in place. So this month and next month, you may have to pay the higher price. Medicare says, don't worry, your plan will reimburse you within 30 days.
There is help for anyone struggling with the cost of medication each month. Here in North Carolina, NC Med Assist is a statewide free program. It's for low-income patients without insurance. You can see if you qualify online. Again, that program is called NC Med Assist. Now, Medicare and Social Security also offer what's called extra help. It's just what it sounds like. Extra help with covering prescription cost, in addition to what your plan already covers. Now, you can apply for up to $5,300 a month. And Greensboro Urban Ministries saw how homelessness could impact those trying to fill a prescription. So they opened a healthcare clinic to help fill the gap, offering screenings, some minor treatments, and medication at no cost to patients. Doctors say they are seeing a different kind of patient each and every day.
And what I'm seeing this year that's very different from the first 2 years, we're talking about a large number of patients coming in here who have just experienced loss of housing.
While it's open just 1 day a week, they've had more than 300 visits last year alone.
Now, if you don't qualify for some of those free programs, there are other discount options that you can try. GoodRx is a website and app that offers free coupons for thousands of drugs. It also shows prices for nearby pharmacies so that you can easily compare. Now, entrepreneur Mark Cuban also got into the low-cost prescription business. He opened up an online pharmacy which can fill to 1,000 generic drug prescriptions. The website breaks down the price of each drug. It includes the actual cost, a 15% markup, a $3 pharmacy fee, and a $5 shipping cost.
With industry insiders predicting drug prices will go up again this summer, it is good to know there are places to help.
Yes, and if you need those resources, again, you can find more about all of them on WFNYnews2.com.